Ready? So, when you guys get your back table pack, just put it in the middle of your table. Remember, it's gonna have the plastic lining on it. It's gonna tell you what it is. So you rip that off, you'll be left with this. You're gonna check the integrity. So we want you to verbally tell us that you're checking the integrity and the expiration date. Okay, if it's expired, we can't use it. Obviously, if the integrity is damaged, like if it has any moisture or any rips or holes, we can't use it either. Okay, so you're gonna check for that. You're going to, there'll be like a little perforated sticker. You're just gonna rip that apart. The sequence for this, thank you. The sequence for this, there's a sequence for everything, so you're gonna wanna remember these. Your sequence for opening your back table pack is away first, toward, and then side. The sides don't matter, it's just however it's folded, okay? So when you do this, you're gonna go away from you first, if it's folded nicely, so don't adjust it like I did, I just am doing that so it's okay? So you're gonna go away from you first, you're gonna grab this one, and you're gonna go toward you. But did you notice I took a step back? Why did I do that?
12 to 18 inches.
Boom, right? We're already exposing something that's sterile, okay? If you guys look, this dark blue, how it's a different color from this, I know it's like pretty close, but it's still different. That's the actual top and inside of this pack. So you already have something sterile exposed, okay? So when you do that, you wanna make sure that you take a step back so it doesn't hit you because we're not sterile when we do this. Another thing I want you guys to notice, when I grabbed this, my hand stayed on top, right? You can't grab that because remember, if we can't see our hand, is it sterile?
Nope.
We can't say for 100%, right? So just stay right here on top, just kind of pinch it and let it go, okay? Now you're gonna grab that basin. You have to do it in a way that's sterile because we have sterile surface exposed. So when you guys go to grab this, watch your distance here, stay on top. A lot of people wanna grab like this because that's the normal way that we would do it, but you wanna stay on top, same reason, you have to be able to see your hands. Stay here, you throw that in your ring stand, move that out of the way as far back as you can to give yourself some room. Now this is showing which way to open it first. So I'm gonna touch it, but you guys can't do this, I just wanna touch it to show you. If you see how this is cuffed, and you see that it's cut right here, this is telling you that it needs to go that way, right? That's what it's telling you. If it was cuffed the other way, it would tell you that it needs to get open that way. So you're gonna look at that, you're gonna see which way it's open at. You're gonna come to the head of the table. You're just gonna use really 2 fingers, just kind of grab, and you're gonna stay low and let it go. Notice the distance between me and the table, right? Now I'm gonna come back and do big circles. Is it okay for me to do that and then walk this close, right? It's not. So as you let it go, big circles, but still have your front to the table, do the same thing. Get to the head of the table, grab this, pull it, you're good to go. Okay, what I don't wanna see, here's a couple of rules. Don't want you guys doing this, why not? Those
You're-
big circles, or big puffs, why do you
Above
do this?
that line.
Okay, so you're thinking sterile, which I don't hate, but it's not correct. But if you were sterile, it would be correct. So remember, yes, we have a sterile field on our body, yes? When we're sterile. If you're not sterile, the restrictions aren't as much. Meaning, if I'm not sterile, I can still touch my mask. I can still fix my bouffant. I can still scratch my neck. I can still whatever. I can still lift my hands up. Only when I'm in that gown and glove, all of a sudden the game changes. Okay? So what's the reason why I wouldn't want to create this much of a scene when I'm doing this?
Does it also have a sterile field?
Well, the top of this is sterile, so you're getting closer.
You can disturb
Sorta.
You don't want
dust
that
and
to fall.
dirt and
Thank you.
things like that.
Thank you. One thing I forgot to tell you guys that I told the morning, into your room, you should damp dust. All the dust that is settled from overnight is now settled on all of our flat surfaces, right? Where we worked, we were spoiled, we didn't have to damp dust. EBS was there before us, she'd wipe our room down, it was good to go. I don't make you guys do it here because it's just not like a skill that you have to learn. Anyone can go and like wipe something down, right? But if you were asked like on a test, like a CST question, or someone just asked you later on, how do you damp dust your room? Proper way to damp dust, you start from the highest points and work your way down, and you only do horizontal surfaces. So you start with your lights, horizontal surfaces meaning your back table, your Mayo stand, your instrument table, and the top of the ring, okay? So yes, the dust is the issue. So that's why when you're doing this, you just wanna be really flat, really controlled movements, just be smooth, and just open. If that side is down and I'm putting this side down and I do this, do you think that's a problem?
Yes.
Why? I'm bringing something from the bottom up that's now much closer to my sterile field. This is what I really care about, right? From here to here. If I do that on this end, and this that's already below the sterile field, so we already are going to deem it as not sterile. Now I'm bringing it up, we're interfering with this. We no longer have that 12 to 18 inches, right? So when you have one side down, you can't disrupt the other side. Now, if I hadn't folded this side yet and I felt like this side was a little too short, can I do this? Yes. Because I didn't disrupt anything,
There's nothing on that side to come
right?
up over our stove.
This is still all on top of my field, so it's okay. It's only when that other side is down, okay? All right. One more time. That's it. So everyone's gonna go through and we're gonna do that. And then we're gonna move on. I'm gonna teach you guys baby steps. But I think if I teach you baby steps, it won't feel so overwhelming. You get one step at a time, okay?
Real quick
Questions?
before you guys begin, you notice there's a bunch of tape on these, right?
Yeah.
So at any time that you guys are opening your packs and they get stuck together, just call it out. Normally it wouldn't happen in the real world, so we'll adjust it for you. But you will see sometimes the tape will stick to each other, making it difficult for you to open. So just say something, we'll come over and we'll fix it.
Easy? Who wants to go? I need 3 people. I see you, and I see you.